two, one, two, three.
Welcome to Ithaca DSA Presents. I am Maribel Tineo, the host for today. I am here with Susan Beckley. Access to healthcare is a top priority for most Americans, with every major poll in the Democratic primary showing majority support for Medicare for all. While all other advanced capitalist economies have some form of universal healthcare provision, our profit-driven and incoherent patchwork of healthcare model has left an estimated 87 million Americans either uninsured or underinsured. A variety of polls show that, in addition to the large shares of Democrats and independents that support Medicare for all plans, a majority of Republican Party members do also. As the pandemic rips through the most vulnerable communities, with the US being the most infected country in the world, support for radical changes in our healthcare system has only deepened. Shockingly, Biden has promised to veto any bill for single-payer healthcare, pushing instead for a public option. This leaves many concerned that his plans will still exclude at least 10 million people and that the profit-driven mechanisms of the system will continue to inflate consumer costs at the expense of quality care. In response, many states, like New York, have taken their fight to the state level. The economic fallout of the pandemic has also made the question of healthcare financing more pressing. The New York Health Act has come very close to passage in the state legislature. Depending on election results this year, there's a good chance of it becoming the law in New York State. Today, we will talk with Susan Beckley about the proposed New York Health Act for single-payer healthcare, the current financing structure for healthcare provision in New York, and how that would change with the New York Health Act. Susan Beckley is a small business administrator. She has managed many small businesses over the past 30 years for small companies with less than 10 employees who do not have health insurance, including managing a physician's office and becoming a medical billing specialist and a medical billing coder, giving her expertise from the economic standpoint of employers, employees, and providers. Welcome, Susan Beckley. Thank you so much for being here. So why don't you start us off with the lay of the land in terms of healthcare access in New York? How are New Yorkers getting health coverage now? And what is the extent of that coverage?
In regards to how healthcare is provided for people, about 49% in New York State have employer-based programs. About 20% of our population is Medicare recipients. And Medicaid covers, certainly with the expansion, about a third of our population. So in looking at that, well, the rest are direct pay or self-pay, and there is some charity when people have no other, cannot pay, and hospitals or physicians will provide some free care. Otherwise, the private insurance industry, there are 14 different companies in New York State that provide over 200 different plans for people to choose from. This is unsustainable and confusing and leads to great administrative costs. Some people are self-pay or just plain uninsured. About 5% of our population in New York State is uninsured. We have co-pays, deductibles for all types of plans, including the government plans. There are co-pays for Medicare as well as the VA programs. There's a little bit of out-of-pocket for Medicaid, but it's very minimal. Most services are covered by Medicaid, whereas for the other insurance plans, private insurance plans are not.
Okay. And how is healthcare funded in the state of New York? How does this affect people's taxes? Which groups bear the heaviest burdens?
Well, 2/3 of the government, the expenditures for healthcare in New York State come from federal programs, which many people may be surprised about. With that, Medicare, Medicaid, CHIPS program, ACA subsidies, those types of things. Because of that, that is directly based upon our taxes and the taxes that New York State contributes to cover those costs to the federal government as well as the state government. Medicaid is paid for 25% by each of the counties. For instance, if New York Health Act was passed, the Medicaid mandate goes back to Albany. The counties do not have to contribute directly. Tompkins County, for instance, has 23.6% of their property taxes go directly to Albany for Medicaid, and Cortland, 29.5%. Those property taxes idealistically could decrease by that amount right off the bat if indeed we did not have the Medicaid mandate. We pay for the benefits for our school staff as well as for the county and state employees, their benefit packages, which are quite good. In Tompkins County, and 5% of the budget would be saved if the New York Health Act was in effect to cover those employees. Our school taxes, again, that they're based on property taxes, the 10 to 15% of a budget line in a school budget just goes for Medicare, medical health coverage. These could show great cost savings for the taxpayers and allow school districts and counties to have more funds for their local districts.
So it sounds like there's a lot of savings involved for schools, for counties. How would this change the lay of the land in terms of healthcare provision? I mean, we started off this conversation talking about a patchwork, an incoherent patchwork of healthcare services. How would that change with the New York Health Act?
Well, as you can see, be it Medicare or Medicaid or your private insurance plans, there are networks, there are co-pays and deductibles. With the New York Health Act, you would not have co-pays, deductibles. All prescriptions, including those for Medicare beneficiaries, would be covered. So we wouldn't have people not fulfilling their prescriptions, leads to a healthier population, but also that, you know, these barriers will be dropped from people being able to access healthcare. And so you don't have to worry about in-network, out-of-network. It provides freedom of choice in healthcare benefits. And if you get recommended to a specialist that's not in your network, you still will be covered. That provides a lot of freedom for our New York population.
As I'm sure you're aware, right now small businesses are really under the gun with the pandemic. They are struggling to stay alive. Given your experience with small businesses, how do you think the New York Health Act will impact small businesses and both the employers and the employees in small businesses?
Well, we know the cornerstone of getting the virus under control is testing. And so, with that, these tests need to be paid for. And so fortunately in New York State, they will cover all of that. But also, I mean, people, if they get tested positive and they're supposed to stay home for a couple of weeks, the employers cannot pay for these people if they're not working. And also people can't do without that paycheck. And so with that, they don't have to worry about that additional outlay for hospitals and physicians, and they will be encouraged to get tested and comply with tracing so that we can all get back to our economy the way it was before.
Right. And what would you say to folks who have union-based insurance, which tends to be better than private insurance, because in the case of union-based insurance, you have both the employer and the union leadership managing the provision of health insurance policies. Why should someone who has union-based insurance support the New York Health Act?
Well, it takes negotiating health benefits off the table, and now unions can negotiate for wages and other benefits, vacation time, paid family leave time, those types of things. Whereas now, with this being the primary negotiating tool, unions are hamstrung in being able to negotiate for other things. Also, regardless of how beneficial their benefit packages are, they're often still with networks. They have co-pays and deductibles, regardless of how minimal they are. You wouldn't have that under the New York Health Act. Also, if you get laid off, or if the job moves out of state, you're out of luck, regardless. And I was just on a conference call with the author of this bill for the New York Health Act, and his big thing in speaking with unions is that you don't have networks that you have to worry about, and also that this will be taken off of the table for negotiations. So each year you're negotiating new contracts, but when you do that, you're negotiating for a new plan. So just say, okay, your new plan is going to be the New York Health Act. And there's nothing in the New York Health Act that prohibits the employer from covering all of the expense for the assessment for people who are paying into the New York Health Act. So it's a win-win situation all the way around.
It sounds like that beyond the health benefits of the New York Health Act, there's also a democratizing impact, because now workers have more leverage in deepening their fight for better working conditions, and employees of small businesses are better able to, or of any whatever size business, are able to have more economic freedom in terms of working, because they don't have the burden of employer-based insurance.
Correct. And if you lose your job, you're still insured. When you have they'll cover the employee, but more times than not, they're not covering your family. So if you lose your job, you're not only losing, your benefit, but also your spouse or your kids are not covered. If you change jobs and for that has different coverage, those benefits, that change goes with you. With the New York Health Act, you have freedom of movement. If you want to leave one job for another or start your own business, you don't have to worry about you, your spouse, your kids, your neighbors' kids, all of your school staff. Everyone is covered. And so with that, you do not have to worry about that consideration when you're applying for a job, or if you want to stay with a job. Many people stay with jobs that they don't like just because of the health benefits.
Right, and it also seems that it has an equalizing impact and unifying impact, because no longer because I'm your employee, I am still able to enjoy maybe the same coverage that you get as my employer. And so one of the things that I'm learning from what you're saying is that our current healthcare model is actually a very divisive model, because it pits employers against employers wanting to pay for the cheapest insurance for their employees. It pits Medicaid recipients against recipients of private insurance. It's a hugely divisive model, and I think to move toward a model that definitely reflects a collective human right, I think also has the added benefit of creating a stronger sense of collective rights. And that is a great precedent in America at a time when there's such oligarchic control of political institutions.
Well, also just on the small business aspect of things, I know a variety of business owners who have very different plans than they have the Cadillac plans for themselves and their families, but their employees have the bronze plan with a $4,400 deductible.
Mhm.
Those are the people who are the least able to pay for those deductibles and copays. As well as just the idea that a healthy work population makes for a healthy business. I mean, you want your employees to be healthy and their families to be healthy in order that you can go to work and feel you don't have the stress of how you're going to pay for medical bills or how sick someone is in your family, be it your parents, grandparents, people in nursing homes. This act covers long-term care as well. And just having those people who be covered who are in nursing homes, as well as covering home health aides where there are people with disabilities or older population who need to have home health services, that will be covered by this bill. That's a huge boon to keep people out of the hospital and out of nursing home care, that they can be taken care of in their homes.
So, so what will this mean in terms of uh, people's taxes? How is the how will the New York Health Act be financed, and what will that mean for the taxation system?
Well, the New York Health Act is very interesting and sort of revolutionary in the way that it's looking to be paid for, because it's not only going to be paid for with people's it's going to be paid for on the basis of ability to pay. And so the first $25,000 of income is exempt. If you are earning or making less than $25,000 a year, by the end of the year, you are not contributing to the New York Health Act. Thereafter, it's a gradual, gradated, progressive tax on wages, just like you pay income tax, your New York State or your federal income tax. And so there's a couple of percentage more per income level that needs to be worked out yet, because the New York Health Act is not dependent on the New York State budget as it stands now. It's designed to be self-funding, so that it's sort of a separate entity from the rest of the budget in that regard. The income that it takes in is to administer the program and pay the beneficiaries, being the hospitals and other doctors and other providers. So the other revolutionary thing about this is that it's going to look at income on non-earned income. So people who are getting capital gains, people who are getting interest income, those sorts of incomes are being assessed also with this, whereas other programs, for instance, Medicare, does not take that into account. So we're looking at a swath of investors and all contributing also. The bill does not state, because it becomes too complex to do so, that what those graded levels are. What is stipulated, the first 25,000 is exempt, and for people over 65, the first $50,000 of income is exempt. The New York State Health Act will pay for the copays and deductibles on Medicare, as well as for VA programs and that sort of thing. So there will be no out-of-pocket balance billing costs to recipients. This brings in a lot of people who are young, healthy people who are not signing up for medical health insurance. It's just way too expensive. They cannot afford it. I mean, the average person in this state is paying $3,400 for insurance premiums. I mean, if you're making $25,000 or $30,000, you can't afford that. And you will still have copays and deductibles with that. So this way, all those people who are, just like you pay into Medicare and Social Security now for when you retire, this will be a trust fund that those monies from your wages or non-wage income will go to the trust fund to cover everybody's healthcare needs.
And that seems so critical at a time when companies are increasingly hiring temp workers who, because they're not full-time employees, do not qualify for insurance. And so it's just such a critical time with so many pockets of vulnerability in our economy. It just seems like the right time.
Yeah, you have people who are doing consulting work, you have temps, you have substitutes, you have seasonal. There's no way people are going to know their income. I mean, of the 10 million jobs created after 2008, 96% of them were in what's called the gig economy. These are not permanent or manufacturing jobs. These are jobs that come and go. And it's very difficult for people to be able to plan their income, let alone that they're going to be able to pay for health insurance premiums.
So how do you explain that, given everything you laid out in terms of huge swaths of people don't have insurance, and even those who have insurance, I think it's over 80% see a point in their lives when they're not covered. And you have such a fractured healthcare system. Why is it so difficult for America to adopt a universal healthcare model while most of its other advanced democracies have some form of universal coverage? What are the forces of power that have to be reckoned with generally, but more specifically in New York State as the fight for the New York Health Act ensues?
Well, yeah, New York State and across the country, your pharmaceutical industry, your private health insurance industry, they're making a tremendous amount of money off of these profit-making models. The Western countries, by and large, have seen and adopted the philosophy that healthcare is a human right, where we have not through our legislation. And so with that, if we're going to have healthcare as a profit-driven, market-based system, then of course you're going to have increasing prices and overall costs. The reason for that is that by definition, for profit means you need to be making more money, increase income, and decrease expenses. And so that hobbles our ability to provide care for everyone across the state and eventually the nation. New York State has this legislation now. It's passed the New York Assembly 4 years in a row. It's very likely to pass in the future. I just got off a call with the author of the bill. We just had a Zoom meeting with proponents of the New York Health Act, and he's very encouraged that come this election, that if we get enough people out there getting in touch with their candidates and their legislators, that we indeed, after this election, should be able to get this passed after the January session begins next year.
That sounds really exciting, and it's the reason why you are here, why I am here, thinking about how individuals can contribute to a push for a healthcare model that is more humane, that is more just, that is more economical and efficient.
Mm.
And I think in America, we confuse costs with efficiency, and that is not necessarily the case. And it's super exciting to have someone like you who's been a leader in leading this work. So as we wrap up, I would love to give you an opportunity to tell our listeners what can they do to support this push for the New York Health Act. We know that the elections are around the corner. What are some things people can do if they want to support the New York Health Act?
Well, certainly go to the Campaign for New York Health website. That's nyhcampaign.org. There's a variety of initiatives on that. That's the cornerstone of the movement. The New York Health Act has a Facebook page with various ways to sign up. The Campaign for New York Health also has a Facebook page in order to find out what's current, what's going on. We recommend people writing letters to their editors. Campaign for New York Health has assistants that if you want to write a letter or tell a story for a publication like a newspaper, then they have people who can help write it for you, help edit it with you. So not to be afraid that you are not able to have your voice heard. The indivisible groups, NYPAN, New York Progressive Action Network, the Grassroots Campaign, are all proponents of this act. The SEIU Union of Nurses is an endorser of the act as well. But right now, it's extremely important for people to get in touch with their current representatives in the Assembly and the State Senate to let them know your sentiments about the New York Health Act, and if you're a proponent, that you want them to legislate for its passage, and also let the candidates who are running know that you are a backer of the New York Health Act. As a constituent, you want them to see it passed.
Well, thank you so much, Susan Beckley, for joining us today. It is quite gratifying to have you, and I hope our listeners will join us in the fight for universal health care in New York, so that New York can be a model for the country, and the country can hopefully follow suit. Thank you so much, Susan.
Yeah, much appreciated. Thank you for having me. We have a Finger Lakes for New York Health local group here that people could get in touch with me. My email is sbeckley, BECKLEY 607 @gmail, and I can connect you with a local group that is very active in getting the New York Health Act passed.
1, 2, 1, 2, 3.